The Minister of Health and Social Welfare, Dr. Mohammed Ali Pate, has called for the gradual end to Nigeria's dependence on foreign aid in funding its response to HIV/AIDS, tuberculosis and malaria. He said the country must take greater responsibility for financing its health priorities as donor funding declines after 2 decades of support. This is as the House of Representatives on Monday commenced its investigation into the utilization of over $1.8 billion and $2.8 billion grants received by Nigeria from the Global Fund and the United States Agency for International Development USAID between 2021 and 2025 for the fight against HIV/AIDS, tuberculosis and malaria, as well as for strengthening health systems. The minister noted that while the donor assistance has saved millions of lives through HIV, TB and malaria interventions, Nigeria's health spending remains below 15% of the Abuja Declaration target, warning that underfunding threatens sustainability.
Every information that you would like to receive, I think we have it and will be provided to you. We also are glad that the EFCC and ICPC are here, and we urge them to also dig deeper so that if there are any issues at the system, that we can collectively remedy them so that the domestic financing that we expect from this engagement will also be used properly.
Chairman of the House Committee on Infectious Diseases, Mr. Amobi Godwin August, said in his remark that the probe is essential to determine how huge grants had been utilized and to ensure accountability in the management of funds aimed at tackling infectious diseases ravaging Nigerians. He commended Speaker Abbas and leadership of the House for renaming and expanding the committee's mandate to the House Committee on Infectious Diseases, reflecting a broader focus on public health threats.
We are aware that the grants received from international partners and donors agencies before now form 90% of the country's intervention and investment in the response against these diseases. Henceforth, we cannot continue to receive grants and aids that reduces us as mere spectators while the donors' countries spearhead the management and administration of those grants indirectly.
The session was declared open by Speaker Abbas Tajuddin through his representative, Mr. Ibrahim Isiaka, stating that the investigation reflects the Parliament's resolve to ensure transparency in health funding. The Chairman, House of Representatives Committee on Public Accounts, PAC, Mr. Bamidele Salam, has said that the future of Africa depends on the quality of values and vision being instilled in its children today. The PAC Chairman said this ahead of the 2025 National Children's Leadership Conference, NCLC, being organized by the Children of Africa Leadership and Values Development Initiative, CALDEF, in Abuja. Mr. Salam, represented by Chairman of the Planning Committee for the conference, Dr. Chibuzo Kereke, addressed journalists on Monday in Abuja, explaining that the event, which is a flagship program of CALDEF, will hold from Monday, November 17 to Friday, November 21, 2025 in the nation's capital, Abuja. He announced that the Vice President, Senator Kashim Shettima, and the First Lady, Senator Oluremi Tinubu, Senate President Godswill Akpabio, and Speaker of the House of Representatives, Dr. Abbas Tajuddin, are among the dignitaries expected to grace the conference. The lawmaker said the conference is themed "The Role of Children in Nation Building, Digitally Smart, Socially Responsible, will empower young Africans with leadership skills, digital literacy, and a deep sense of social responsibility." It is to bring together over 400 participants between the ages of 13 and 19 from across the continent for an extraordinary experience of learning, leadership, and community development. The grand finale of the conference will coincide with Universal Children's Day on November 20, symbolizing CALDEF's commitment to advancing the rights and voices of children as active contributors to nation building.